So today we have a patient of left complete cleft lip alveolus and palate. He is a 19-year-old patient now. We had operated him for cleft lip, cleft palate, and secondly alveolar bone grafting in his adolescent age. And 1 year back he had undergone Lefort 1 maxillary advancement. His present complaint was moderate amount of hypernasality, that is nasality in speech, because of moderate vilopharyngeal insufficiency. Apart from that, he's having a anterior palatal fistula and also having a cleft nasal, typical cleft nasal deformity, that is unilateral cleft nasal deformity with depressed ala, flaring of the ala, as well as broadened dorsum of the nose. So we are planning, our plan for today is increasing the palatal length, that is palatal lengthening with the Furlow's double opposing Z plasty, along with palatal fistula closure with local flap. For the nose, we'll be taking the septal cartilage graft and lifting the lower lateral cartilage to gain the, achieve the LLC symmetry. Apart from that, we'll be doing lateral nasal osteotomy to narrow down the dorsum and do a little bit of lip revision as well.